Good day everyone, I am KREISHA MAE Joy Pesidas from BSN 1A, and today I will be performing applying the hot compress. Hot application is the application of a hot agent warmer than skin either in the moist or dry form of the skin surface. Objectives: to decrease pain that indicates problem, to decrease any inflammation, and to promote healing, circulation, and separation. Safety and security measure. Never apply hot compress for more than 30 minutes. Allow the skin to return to normal temperature before repeating application. And prolonged direct contact of the hot compress can damage skin, so always be sure to wrap your hot compress with towel. Pre-procedural preparation. Wash hands and wear gloves. Introduce yourself to the client and identify the client's identity. Explain what are you going to do, why it is necessary, and how the clients can cooperate. Good day, ma'am. Ako day si Keisha, your nurse for today. And mag-apply ta sa ma'am. Mag-apply ta hot compress sa inyong kuan. Ano sa yung pangalan niyo, ma'am? Ako din si Glenn Edon. Gather the necessary equipment and provide privacy. Steps. Check the physician's order or reason for the warm compress. To know why this therapy is applicable to the patient's case, warm compress is not suitable for all injuries. Determine the patient's condition, medical diagnosis, and any history of diabetes mellitus or impairment in sensation to avoid higher risk or burns and further complications. Assist the client's skin for areas of redness, breakdown, or scar tissue. If open wounds are involved, carefully assist the open wounds. There are types of skin that is sensitive to heat. Exposure to extreme heat can cause severe complication to the open wounds and to the patient's skin. Check if the hot water bag is in good shape and without any leaks. The water bag must be functional so it cannot cause damage to the patient. To check for leaks, pour water into the bag, cover and turn it upside down. If there's no leak, discard the water. To check for leaks, Leaks can cause further injury to the patient. To test the temperature of the water, test the temperature of the water with the bath thermometer. The safe water temperature should be at 50 degrees Celsius in order to avoid burns. Pour the water from the pitcher into the hot water bag until it is about 1/2 or 2/3 full. If the hot water bag is filled too full, it can be dilated and become hard and heavy, which will not be flexible enough to mold comfortably to the body parts. Expel air from the bag by laying it into the flat surface. Turning the opening upwards. Air is not a good conductor of heat. Air in the bag will interfere the transfer of heat. Screw the cup. Wipe the bag. Cover. Turn it upside down and look for any leaks. Securing the top prevents leakage of water and discomfort to patient. Place a warm cotton flannel around the bag. Do it in an envelope style. Cloth protects skin from the direct contact with the bag. Bring the hot water bag to the patient's bedside. Identify the client and minimize client anxiety and promote cooperation during the application. Put it in the affected area after or on the region indicated after thorough assessment. The opening of the bag should face away from the patient's body. Applying hot compress on the specified time promotes treatment effectiveness and to ensure safety and prevent accident. Let the hot water bag stay for not more than 30 minutes. Check for burns after 5 minutes of application. When the use of hot water bath is discontinued, stop the application and make patient feel comfortable. Too much exposure to the heat can cause complications. The patient's comfort is one priority of the nurse. Do the aftercare. Remove the cotton flannel and place in the hamper. Ensure proper self-care after discharge or for the continuity of care to ensure that it is dry. Remove water from the bath. Wash it with soap or water. Rinse and wipe it well. From the mixed procedure and prevent growth of microorganisms. Inflate it a little, screw the cup, and return it to its proper place. Two sides of the bag should pull apart so they will not stick together during the drying. Record. Procedure done. Patient's feeling before and after application. Kasi magpamatin ng before and after application. Parang sama. And report any unusual findings. Recording data provides coordination of care and ensures continuity of care.